Moving on to something that's very, very, common when you go to the dentist. So you're told you have a cavity, and,
Yeah,
and the dentist says, we got to drill right away. What would you say to someone as a second opinion if you're told you have a cavity? What should someone do? Look for a second opinion, freak out and get the drilling? Like, what do you do?
this depends. This depends. So a skilled biodentist obviously classifies the cavity in like how deep is it.
Mm,
So if it is, so the outer part of your tooth is called enamel,
mhm.
and the enamel is the hard thing. So if you have initial tooth decay and it's still in the enamel, then I personally would never drill, because we know that if we support our body now with lifestyle nutrition, and then we can reverse it.
Mm,
Because basically the tooth builds itself through the blood supply, which is like from the pulp inside out, and then has this dental fluid, but it also comes through saliva. So if the saliva is rich in minerals and nutrients, you remineralize all the time. But therefore, as a biodentist who is trained, you will then give your patient the recommendation. You will get the recommendation as a patient. Oh, can we check your vitamin D3 level, please? It's probably low. And oh, what does your diet look like? Because it's quite clear that if you have tooth decay, that you either have a vitamin D3 deficiency, or you're gluten intolerant, or both of it, and therefore having lack of minerals overall. So this is the first step. If it's a huge cavity, obviously the ship has sailed, and then you need to fill it and drill it and bill it. So that's what they say. But again, there's always the fear then, but my dentist said I need a root canal. You don't
mm,
need a root canal. You only need a root canal when you're really in massive pain. The thing is, we are not trained to understand that the tooth can heal itself, even if the cavity is super close to the nerve. But obviously, if you as a patient run around in hibernation mode, like all of us out there, you probably have a tooth that dies. So he's right with you need a root canal. You understand the culprit here? You have to be preparing. So there's the bone healing protocol, which supports the dentin number 3, the tertiary dentin that rebuilds itself. Again, protein is key, vitamin D3, K2, minerals like magnesium, zinc, boron. It's all in the bone healing protocol. But it is something that people forget. They only think about teeth. They need to be brushed. So everyone knows a toothbrush, toothpaste, right? Maybe even oral, like, what is it? Tooth mouthwashes and
yeah.
floss. But how can it be that we are so much better in oral hygiene, but we still, tooth decay is still chronic disease number 1 with 90% of incidence? So
Mm,
something doesn't add up. There's
yes.
great research showing that our Paleolithic ancestors, they had a lot of tartar and black buildup and stuff, and not really clean teeth. Maybe even like stuff in there.
Mm,
Definitely not white teeth,
mhm.
but they had no sign of inflammation. And they even proved that in one, like 2 years ago in the University of Freiburg, when they just had 1 month standard Western diet, Paleolithic kind of, let's say, paleo-ish food design. 1 month, 100% less inflammation in gum and teeth and everything. So maybe it's your lifestyle and nutrition. But obviously, we are trained to just repair, and the band-aid for classical Homer Simpson is just, you didn't brush your teeth, that's why you have tooth decay. You didn't use your floss, that's why you have bleeding gums, and you didn't use your mouthwash. Because if you would have used that chlorhexidine, it would have been gone. Yes, maybe, but it's just a band-aid and it's a quick fix.
Yeah.
So work on that overall thing.
We got to go deeper than that. And so much of that
Yes,
starts with the nutrition. We got to look there also. And the decisions we make day after day after day that lead to it. That's how you can reverse. And you can reverse so much of this.
you can reverse. If it's like I said, if it's huge, massive hole, you probably can reverse it, but you should never go that way. So ideally, let's see this way. In nature, our teeth are immune against tooth decay. They are hard
Mm.
as a stone. Just because we got soft, because we got convenient, we're sitting around, we don't even eat anymore. We can drink our food. We can even call someone to bring it, so we don't even have to move to get it. So when we were eating, let's say, meat from the bone, and therefore this hard stuff would already clean our teeth, or raw vegetables, it just cleans it. We now eat processed sticky foods and smoothies and way too much,
Yeah.
and we got soft. And our teeth got soft. And you can see it is 90% incidence. This is number 1 chronic disease worldwide. And it's 100% reversible. Isn't that insane?
Absolutely insane.